Good afternoon and welcome to our Facebook Live broadcast with Capital Digestive Care. My name is Janine, and today we will be discussing colorectal cancer screening and prevention. Colorectal cancer is the third most commonly diagnosed cancer in both men and women in the United States. Recent research published by the American Cancer Society shows that in the U.S., colorectal cancer is now the number one leading cause of cancer deaths in men and the second leading cause of cancer deaths in women, only behind breast cancer. The good news is that colorectal cancer is one of the most preventable types of cancer thanks to screening. I'm joined today by three expert gastroenterologists from Capital Digestive Care: Dr. Dominique Howard from our Washington, D.C. office, Dr. Darryn Potosky from our Laurel and Columbia, Maryland offices, and Dr. Syed Thiwan from our Norfolk, Virginia office. Stay tuned to hear more, share this broadcast with your friends, and if you have any questions for our experts, leave them in the comments below. We will answer them during our broadcast or shortly after. Thank you for joining us. Dr. Howard, let's start with you. What exactly is colorectal cancer?
Thank you for having me here, Janine. Colorectal cancer is a common disease. Colon cancer is when the cells on the lining of the colon grow out of control. We do believe that colon cancers start as growths in the lining of the colon, and these growths are called colon polyps. We can remove these polyps that are growths during a colonoscopy. As you mentioned, colon cancer is the third most common cancer affecting both males and females, with males being higher in incidence than in females. There is also a higher incidence of colon cancer in Black Americans than in white Americans. We are going to hear about other factors, both environmental and genetic, that increase the incidence of colon cancer shortly. Thank you all for joining us.
Thank you, Dr. Howard. And Dr. Potosky, could you tell us more about who is at a higher risk for colorectal cancer?
Sure, Janine. This is a really great question and something we commonly hear our patients asking us every day in the office. What can I do to reduce my risk of a disease? And I tend to think about risks for colon cancers in two different categories. So there are of risks that we can change or that we have control over in order to prevent or decrease our risk of colon cancer. And then there are risk factors that we have no control over, that are just part of us and we can't modify. The risk factors that we have the control to change include things like body weight. So being overweight or obese has been identified as a risk factor for colon cancer. Reducing weight can reduce your risk. Smoking and alcohol use habits have also been identified as modifiable risk factors for colon cancer. There are also several factors that we can't change. They are just part of our human beings. These include our racial and ethnic backgrounds. As Dr. Howard mentioned, there are certain backgrounds where there are increased risks of colon cancer. Those include American Indian, Black Americans, and Jewish people of Eastern European descent. Those of us who have a family history of colon cancer or high-risk polyps have an increased risk for colon cancer. Patients who've had their own history of polyps have a higher risk to develop more polyps and thus a higher risk of colon cancer. And then certain diseases like inflammatory bowel diseases, which we also call Crohn's disease or ulcerative colitis patients, have higher risks for colon cancer, along with patients who have inherited genetic syndromes such as Lynch syndrome or FAP, which stands for familial adenomatous polyposis syndrome. Both have higher risks of colon cancer.
Great. And Dr. Thiwan, what are the symptoms that signal to someone that they need to see their doctor or a gastroenterologist?
Thank you, Janine, for inviting me. It's an important topic. We need to discuss about it. Colon cancer is a very slow-growing cancer. So it starts out as a small polyp, like Dr. Howard mentioned. It may take 10, 15 years before it becomes cancer. So that's why vast majority of the patients may not have any symptoms, especially in early stages. But the common symptoms that we generally see are abdominal pain or change in bowel habits. So patients may start having constipation or diarrhea, which is new to them, or they may see a change in their stool consistency or the shape of the stool. Some may report, doc, my stool is getting thin like a pencil. So that could be a warning sign. Sometimes they report bleeding. The bleeding could be in the form of bright red or dark red blood in the stool, or blood coming out of the rectum or on the tissue when they wipe themselves. Sometimes the bleeding can be silent in the sense that the blood loss happens over a period of months, if not years. They become anemic, especially iron deficient. So that makes them weak and tired and fatigued. Then they may start losing weight without any clear reason, or they may not be dieting as such. So those are some other common symptoms, somewhat early symptoms. If the cancer is advanced, then it may lead to bowel obstruction in the sense they may start having abdominal pain, a lot of abdominal pain, nausea, vomiting, can't keep anything down, not able to pass gas or have a bowel movement. If the cancer is spread somewhere else, like chest or somewhere else, they may start having pain in other locations. But one thing to remember is, all of these symptoms overlap with a lot of other GI conditions. So just because you have one or two of these symptoms doesn't mean you have cancer. The message here is get, screened or get checked so that, if it is turns out to be a cancer, it can be, detected at the early stage and you can be cured.
Excellent. Dr. Howard, speaking of screening and prevention, why is colorectal cancer considered one of the most preventable forms of cancer?
Great question, Janine. This is because colonoscopy screening can both detect and prevent colon cancer by removing these precancerous polyps that later could develop, as Dr. Thiwan mentioned, into cancer.
Excellent. For those of you who are just now joining us, welcome. Please remember to like, comment, and share this broadcast with your friends and family. If you have questions for our panel, please leave them in the comments below. We will be answering them during the broadcast or shortly after. The recommended screening age for a person of average risk is 45 years old. Dr. Potosky, could you please explain what this means and why screening starts so young?
Absolutely. This question also comes up all the time, especially since these recommendations have changed in the past few years. Previously, we would start screening people at 50 years of age. And as you mentioned, that's now changed to age 45 for the entire population. As many of my colleagues have already mentioned this evening, excluding skin cancers, colorectal cancer is the third most common cancer diagnosed in men and women in the United States, and the second most common cause of cancer death when men and women are combined. If we look at older adults, we'll say older than age 55, we've seen that cancer rates have been decreasing at about, every year we're seeing less and less older adults being diagnosed with colon cancer or dying from colon cancer. But in younger adults, less than 55 years of age, rates of colon cancer have been increasing at about 1% to 2% per year. And in addition, the rate of dying from colon cancer in these younger adults has also been increasing at about 1% per year. And so these are the reasons why we started screening early. And I know we're going to get into some questions about why this may be the case. But the key in my mind from what Dr. Thiwan and Dr. Howard have been mentioning is, we are talking about all these symptoms, and it's really important for people to just not ignore symptoms. If you're not sure why you're feeling a certain way and it's not normal for you, go get checked. Talk to your doctor about it.
Great.
Completely agree with that.
Absolutely.
Dr. Thiwan, we received a question from an audience member who asked if experts know why colorectal cancer rates are rising in younger adults.
It's a good question. As you mentioned, ACA and American Cancer Society data, and then Dr. Potosky mentioned the cancer rates are increasing in younger population. But if you look at the overall the rates of cancer in all of the population, it's coming down in the last couple of decades. So we don't really know why this increase in young people's cancer is happening, but we don't have a clear answer why this is happening. There's not one clear answer. It's usually multiple factors. Experts think probably lies in diet and lifestyle factors. So foods that are rich in highly processed ingredients or high fructose corn syrup, they have a higher risk of increasing the colon cancer. Then people who eat a lot of red meat, doesn't eat a lot of much of fiber, fruits and vegetables, they have a higher risk as well. So the food that have high processed ingredients have a high sulfur content. They tend to interact with the gut biome, gut bacteria, so that can in turn increase the risk of colon cancer. Then the usual standard risk factors like obesity, Dr. Potosky mentioned, and diabetes, and living a sedentary life where you're not active, not exercising, smoking and drinking alcohol in excess. Those are all the standard risk factors that not only for colon cancer, a bunch of other cancer. I think hopefully future research will shed some light on this so that we can find what is the exact factor or reason that this increase, so that we can prevent it or mitigate it.
Perfect. Thank you for answering that question, Dr. Thiwan. Dr. Howard, a colonoscopy is referred to as the gold standard for colorectal cancer screening. Could you please explain why?
Absolutely. That's because the colonoscopy can both detect and prevent colon cancer by removing precancerous polyps, as we've mentioned several times tonight. So that is why it's considered the gold standard. It's the most effective test that can accomplish both things of detection and prevention.
Excellent. And Dr. Potosky, despite the benefits of a colonoscopy, a lot of patients are reluctant to get the procedure because of the prep process. What is it about colonoscopy prep that some patients find difficult?
One of the most important factors of a colonoscopy for us as gastroenterologists is having a colon that is well cleansed or emptied of stool. And that allows us to do the best job we can to see and detect these precancerous polyps and remove them to prevent cancer. So in order to have a good quality colonoscopy, patients have to work a little hard to clean the stool completely out of the colon. And this involves a couple steps, which include reducing food intake over really the day before the test, but some foods we limit for a little bit longer. The day before the test, patients are on a prolonged period of a liquid-only diet intake. The hardest part is, taking the bowel cleansing regimen to clean all the stool from the colon. And so in the past, doing this has required drinking very large volumes of terrible tasting liquids. But in recent years, the options have become a little more broad, still not perfect, but a little better for patients. And these include using liquids of smaller volume. Companies are coming out with things that may taste a little bit better, a little more palatable for people, like sports drinks. And there are even now tablet-based preparations for patients who find that easier. All of the preparation, or the bulk of the difficult part of the preparation, is done about over a 12-hour period of time. So it is still a small amount of time in our lives that it takes to go through what is not an easy process, but is for a very important reason.
Excellent. And when it comes to the procedure itself, we often hear that some patients feel self-conscious or embarrassed about having a colonoscopy. Dr. Thiwan, what would you say to a patient who feels this way?
I can certainly understand that colonoscopy is an invasive procedure, involving the sensitive parts of the body. But remember, this colonoscopy is a life-saving, cancer-preventing procedure. It's millions of people have them done every year. And it's a fairly short procedure, 20 to 30-minute procedure. The physicians who do them and the staff involved in the care of patients are all highly trained, well-experienced professionals. And we take, a great pride and joy in taking care of, patients. And we would make, patients feel comfortable and at ease. And often the procedure is done under sedation. So, almost 99% of the time. So patients don't really feel anything. Often in the recovery room, some of the patients will tell me that this is the best nap I ever had. Can I take this medicine home? He said, this is not something you can take home. So, if you still have concerns or questions, my advice is to come early during the day of the procedure, or set up a pre-procedure visit so that you can talk to the physicians and staff and ask all your questions, get your concerns addressed, so that you don't have to worry about it. But I'll tell you a story about a patient who came a few months ago, and as I walked into the room, she said, I don't know why I'm here. I'm wasting your time and my time. I'm not going to do colonoscopy. And she apparently saw another physician 2-3 years ago, didn't follow through with the colonoscopy. So I asked her, let me hear you. Let me, try to answer your questions. And then you decide whether you want to have it done or. And she said, I heard that horror stories that 3 days of fasting and taking this awful prep and it makes you puke and have diarrhea all night long. And so I told her that that's not the case. You don't have to fast for all 3 days. You only have to take maybe clear liquid diet, or, nowadays we even have a low residue diet, which is, for a day or two. And, now we have low volume preps that you drink less amount compared to years before. And you also have pill preparations, and you can take anti-nausea medications. And after all that conversation, she agreed. There was a cancellation 2 weeks later. She took that spot, and I did her colonoscopy. Unfortunately, she had colon cancer. So I had to send her to surgery, and she's cured now. But imagine if, she came in at late and it was an advanced stage, then she may not have been cured. So I think the point is that if you have any concerns, questions, come talk to us. I think at the societal level, I think we need to start talking about, poop, colonoscopy, colon health, gut health, and all that stuff. So, we can start normalizing this conversation about the colonoscopy, so people are not embarrassed about having one.
Excellent. And Dr. Howard, we have another question from an audience member who wants to know if patients feel anything during a colonoscopy. Could you please give us a general overview of the procedure and what the patient can expect?
Sure, Janine. That's also a great question. The colonoscopy itself involves passing a very thin tube that's flexible and has a fiber optic lens or camera at the end of it. We pass this tube through the rectum into the colon, and as we do that, we insufflate air, because the colon is normally a flatter tube, and so we have to put air in the colon so that we can see polyps and possibly remove them in order to prevent colon cancer. Dr. Thiwan mentioned that many people are concerned about if they're going to feel something and they're a little apprehensive, but most patients do receive medication during the procedure. This medication is administered through an IV, and it is a type of a sedation. So most patients, as Dr. Thiwan mentioned, will just fall asleep, and then they wake up and the procedure is done. And it ends up either saving their lives in many ways, catching an early cancer, or catching polyps, or giving reassurance that there's nothing there. Either way, it's important to have the test done. And as Dr. Thiwan mentioned, I thought he mentioned a very important point about if you do have concerns and any apprehensions, please just come in and have a conversation with us and let us explain to you better what this procedure is so we can convince you to have it done.
Thank you for that overview. Dr. Potosky, we've talked a lot about colonoscopies, but there are other test options like Cologuard. What is Cologuard, and what advice would you give to a patient who's interested in that particular screening option?
Sure. And everybody has seen, Cologuard advertises on television these days, so we all have some exposure to this test. So it's great to know the pros and cons of all the different ways to screen for colon cancer. Cologuard is a stool-based test where patients have a bowel movement at home into a container that they send off to a company, and it gets tested for microscopic blood in the stool and cancer cells as a means of detecting colon cancer. We all use Cologuard as well as colonoscopy in our day-to-day practice. In my opinion, if a patient is healthy enough to undergo a colonoscopy, it is the best test that we have available to screen for and prevent colon cancer at the same time, as Dr. Howard and others have mentioned this evening. If patients are really not interested in having a colonoscopy, I will absolutely provide a Cologuard test because I think it's critical for patients to get screened in some manner, one way or another. With Cologuard, the most important thing to understand that differentiates it from a colonoscopy is that it doesn't detect routine polyps. And by that, I mean it's intended to detect colon cancer or polyps that are essentially on their way to becoming cancer soon. It doesn't detect the polyps that we can detect and remove to prevent them from ever reaching those stages that are close to cancer or cancer itself. Thinking about that, if your Cologuard test is negative, doesn't detect anything, it's still possible that you are missing an early polyp or a small precancerous polyp that may still progress over time into colon cancer, whereas those polyps will be detected and removed by your gastroenterologist at the time of a colonoscopy.
Good points, Darryn. Oh, I just was going to say that's why we repeat the Cologuard at the 3-year mark for those reasons. But I agree with Dr. Potosky that, if you're apprehensive about having a colonoscopy, that's another option to consider because, we would like to make sure that patients are screened in one form or the other.
Something is better than nothing.
Absolutely.
Thank you guys for that. And let's do one more question from our audience before we wrap up. Dr. Thiwan, another question asks how often someone needs to be screened for colorectal cancer.
So it depends on whether you are in an average category or not. I think Dr. Potosky, talked about the high-risk category. So if you don't have any family history of colon cancer or advanced polyp, or you didn't yourself have a colon cancer or a colon polyp, don't have any history of Crohn's disease or colitis, you get a colonoscopy that's normal, then you get it every 10 years. If you choose a different test, a flexible sigmoidoscopy, which would be just examining the left 1/3 of the colon, or a CT colonography, which would be an X-ray exam of the colon. If it's normal, then you get it every 5 years. Often sigmoidoscopy need to be combined with the stool test. If you end up choosing the stool test, which would be a couple of different tests. One, Dr. Potosky talked about the Cologuard. You see it on the TV ads all the time. That'll be every 3 years. But if you choose a more simple test called FIT test, which would be fecal immunochemical test, which detects hidden blood in the stool, you have to do it every year. Suppose you're in a high-risk category, then your gastroenterologist can decide how often you would need to have a colonoscopy after your first colonoscopy. But one thing to remember is if you're in high-risk category, the only test that applies to you is colonoscopy, none of the other tests.
Thank you, Dr. Thiwan. As we wrap up, what message would each of you like to say to someone who is just turned 45 or over the age of 45 but has not been screened for colorectal cancer?
I'd like to say that colon cancer is very preventable. It is common, so it is important to talk to your doctor about different screening options. Colonoscopy is not as scary as it sounds. Please talk to your provider or come and talk to a gastroenterologist about the colonoscopy so he can explain to you what it is and what it entails. And most people have a colonoscopy. After they have it, they're very thankful and they realize that it wasn't quite as cumbersome as they thought it would be and not as scary as they thought it would be. And it does save lives, so it's important to get screened for colon cancer.
I think Dr. Howard kind of said it all there. I echo her comments and would just reinforce that colonoscopy exams have been proven to reduce colon cancer diagnosis and colon cancer related death. The process of getting to a colonoscopy may be inconvenient, but saving your life by preventing colon cancer is never inconvenient.
Great point.
I completely agree with both of them. I think the goal of any cancer screening is prevention. That is the key thing to remember. It's not just detection, it's prevention. So even if you end up detecting cancer, you would want it to be an early stage so that you are cured of the cancer. So if you have not gotten screened, it's time to talk to your primary care physician or one of us gastroenterologists. We can partner with you to find what is the test that best suits you. The test that gets done is the best test. Doesn't matter what test. As I said, something is better than nothing. So colonoscopy has the advantage of being a single step where it detects cancer as well as prevents cancer by removing the polyps. While all the other tests, if it's positive, you would need to have the colonoscopy. So my message is start paying attention to your body, see whether you have any symptoms, gather your family history, and see your primary care doctor or one of us. Stay healthy by eating right, avoiding high fructose corn syrup, red meat, and processed food. Eat more fruits, fiber, vegetables. Stay active, exercise, don't smoke, don't drink alcohol in excess. That's going to prevent not only just colon cancer, a whole bunch of other cancers, and even heart disease.
Excellent point.
Thank you.
Great. Well, that wraps up our broadcast. Thank you, Dr. Howard, Dr. Potosky, and Dr. Thiwan for joining us today. And thank you to our viewers for watching and asking questions. If you have any additional questions, it is not too late to ask them. Please leave your questions in the comments and our physician panelists will reply after the broadcast. If you or a loved one would like to schedule a colorectal cancer screening or colonoscopy with one of our providers, please visit our website, capitaldigestivecare.com. We'll see you next time.